before bathing or at bedtime, be certain that you are adhering to the exact time that has been indicated. The fourth is the right dose. If you've been asked to spread this medication over the entire leg, that means that you need to make certain that you not only apply the medication in the front of the leg, but as well on the back of the leg and in all of the folds of the skin. Allow only a thin layer to be placed on the skin. More is not better when you're applying medication, so you would not want to apply a thick layer. Finally, you need to have the right location or the right route. And make sure that it is on the patient's skin in the right place. Read the directions carefully. Make sure that you know exactly how it's to be used. Many of these applications to the skin need to be shaken before they can be used. Some need to be inverted upside down. All of those instructions will be carefully written out on the directions. So look at those before applying any of these. You will be applying medication to unopened, intact skin. By law in the state of Wisconsin, you are only permitted to do this. You may not apply medication to cut or another form of open skin. The reason why that's so important is because if the skin is open, it allows medication to get into the deeper layers, into the bloodstream, and can go to all areas of the body. Do not apply medications to mucous membranes. Mucous membranes make up the linings of the body openings such as the mouth, the eyes, and the rectum. Unlike the skin, mucous membranes don't have a tough outer layer of dead skin to protect the underlying tissues. Instead, their surfaces are moist and easily penetrated. Medication absorption through mucous membranes is rapid. Nitroglycerin is an example of that. If you recall, sometimes patients who have chest pain need to take quickly a nitroglycerin. It's placed in their mouth, underneath their tongue, against those mucous membranes, and where they rapidly get into the bloodstream. Never apply skin medication to mucous membranes, as this can cause over-medicating or other harm to the individual. Be certain to report your observations. Note the appearance of the skin with each application. Has there been a change for better or worse by the use of this medication? Has there been any change at all? Maybe if there is no change at all, the medication is not working, and that too you would want to be sure to report. Are there any signs of irritation on the skin caused by this medication? Could be redness, swelling, maybe warmth, or pain. Note also any medication sensitivity, such as rashes, dryness, ruptures of surface blood vessels, or any itching that the patient might be experiencing, and report any and all of those. People who have chronic skin conditions need emotional support. Living with constant itching or pain is a very stressful thing. They may lose sleep because they are so uncomfortable, and they might become depressed over their condition. Especially this is true for folks that have a condition that is chronic and a lifetime. Patients with skin conditions such as psoriasis, I don't know how familiar you might be with that skin condition, but there's a lot of scaling and itchiness to that. Also very unsightly patches that are on all surfaces of the skin, can be on the face, the scalp, the hands, the arms, legs, and can cause a lot of distress. And frequently, people with severe skin conditions such as that need to have some special counseling. Acne is another thing, particularly on the face, that can be distressing and cause emotional troubles for young people who have body image issues that are so important at that time in their young adult years. So show support by accepting their feelings and respond to their needs with patience and understanding. Prior to applying any medication to the skin, you want to be certain to wash your hands as you do with any other procedure, but in addition you would want to wash the skin area that you're going to be applying this medication to with soap and water, and then rinsing it well and drying it. Whenever you're applying any medication to the skin, you will want to be wearing gloves to be sure that this medication is not going to be remaining on your skin. Creams need to be rubbed gently into the skin by hand. Lotions tend to be thinner than most other kinds of medications that are applied to the skin, and as a result need to be patted onto the skin by use of a 2x2 gauze or a cotton ball. Ointments are to be applied with a cotton-tipped applicator or a tongue blade. To remove ointment from a jar without contaminating its contents, you would want to place the cap upside down on a clean surface and remove the amount desired using an applicator or tongue blade. Never dip in and out using the same applicator. Administer the medication from the center outward, never going back over the skin after the application. Be sure the skin surface is completely dry before applying powder. Fully spread apart any skin folds, such as between the toes or under the arms, before applying, so that it can be distributed evenly. Turn the patient's head to the side to avoid their breathing in any of the powder particles. Aerosol sprays need to be shaken vigorously prior to their use. Spray the area from a distance of about 3 to 6 inches. Direct the spray away from the face and be sure to try to apply it evenly to the skin. A foam medication also needs to be shaken vigorously prior to its use. The can is then inverted and you spray it into your hand or directly onto the skin. For using a paste, you first of all need to puncture the tube by inverting the cap back into the tube. And once the paste container is punctured, then you can squeeze the paste onto an applicator and apply it onto the skin in that fashion. Disposal of your supplies, such as tongue blades, applicators, cotton balls, and so forth, need to be done in an appropriate waste container. Never leave your items